you to the Ministry of Health's COVID-19 update for Wednesday, 25th May 2022, where we provide you with accurate and up-to-date information on the national COVID-19 response. Your presenters for today are the Honorable Terence Dayal Singh, Minister of Health, Dr. Roshan Parasram, Chief Medical Officer, and Dr. Erica Wheeler, PAHO WHO TT Country Representative. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will moderate this morning's conference. We begin with the CMO, who will present the latest clinical update on the parallel healthcare system, followed by a presentation on the Pfizer Pediatric COVID-19 vaccine.
Hi, good morning. Thank you, Mr. Alexander. Good morning to the Honorable Minister. Good morning to Dr. Wheeler, members of the media and members of the viewing and listening public. So we begin with the update for Tuesday, 24th May 2022. Total population vaccination status 50.9%. New positive cases over the last 24 hours 676. Total patients in hospital 198, and that is hospital and step-down facilities. One reported death over the last 24 hours. Condolences to the relatives of that individual. The rolling 7-day average for deaths now stand at 2. Total active positive cases 9,523, and patient vaccination status, again, the majority of those hospitalized would have been unvaccinated, and again, deaths, a similar trend would have been noted. In terms of our hospital breakdown, just a little more detail. Total persons in hospital 198, by facility, Couva Hospital and Multi-Training Facility 48, 3 persons in ICU, 5 at the High Dependency Unit, Cora Hospital 46, Augustus Long 40, St. Anne's Hospital 8, Arima General Hospital 14 persons, Point Fortin Area Hospital 8, St. James Medical Complex 24, Scarborough Regional Hospital, Fort King George 10. If I could have the first slide of the pediatric presentation. So as you know, WHO has approved, next slide please, on January 21st, 2022, the Strategic Advisory Group of Experts, SAGE, recommended using the pediatric Pfizer-BioNTech COVID-19 vaccine in children between the ages of 5 to 11. Prior to that, there was a vaccine that was approved for 12 and above. If you look at the top of it, it's a different color. So the purple vial is 12 and above, and the orange color vial is actually for the pediatric version, 5 to 11. Next slide. So I think we skipped one. If we could go to the pediatric vaccine administration side, yes, this one. So it's a different formulation, and it actually is a lower dosage than that authorized for persons 12 years and older. Children to be given 2 doses at 10 micrograms, the adult, which is 0.2 mils each. This is opposed to 30 micrograms, 3 times the dosage, which is given to 12 and above. Administered intramuscularly into the upper arm, and the second dose is recommended by the SAGE group again to be given 4 to 8 weeks after the first dose. Persons 12 years and older receive doses measuring 30 micrograms, as said before. Next slide. So if you look at the side effects, we have those that are common and those that are considered very rare. So common side effects will be fever, which usually lasts a day or 2, pain at the injection site, and some tiredness. Very rare complications, myocarditis and pericarditis, similar to the 12 and above, hypersensitivity, and of course, in terms of contraindications, a history of anaphylaxis or allergic type reactions to any component of the vaccine is a contraindication to its use. So we advise that you tell your healthcare practitioner or person administering of any history of allergies. Children with a history of allergic reaction should consult a pediatrician or their primary physician prior to receiving the COVID-19 vaccine. Last slide, please. So last slide just re-emphasizes the wearing of masks, watching your distance, and washing your hands. And on the background of what is happening globally with monkeypox, and Dr. Wheeler will go into detail, I think we need to re-emphasize the wearing of masks, watching your distance, and washing your hands. And most importantly, as it relates to COVID-19, getting your vaccine when it is available. Thank you, Mr. Alexander.
And thank you very much, CMO. We welcome back Dr.
How can I help?
We welcome back Dr. Erica Wheeler to the press conference to share information about monkeypox, exactly what type of disease it is, the risk of contracting it, and what we need to do to protect ourselves from it. Dr. Wheeler.
Thank you very much, Mr. Alexander. Good morning to the Honorable Minister of Health, and good morning to the CMO, the viewing and listening public, and to the media. Thank you for the opportunity once again for PAHO to give this update. Can I have the first slide, please? The next one. Thank you. The next one. Thank you. Okay. So this is a description of monkeypox, which I know that you have heard from the CMO before, but just going over it again briefly. As of the 21st of May, there were 92 laboratory confirmed cases and 28 suspected cases of monkeypox, with investigations that are ongoing. These have been reported to WHO from 12 member states that are not endemic for monkeypox virus. But as of yesterday evening, there's been another update from WHO which points out that there are now 158 confirmed cases and 117 suspected cases under investigation that have now been reported in not 12 but in 19 non-endemic countries across the 4 WHO regions. We know, however, that there are no associated deaths reported to date. We also know that the samples were confirmed by PCR testing, which you're familiar with from COVID-19, and have been identified as being infected with the West African variant of monkeypox. There are no reported cases to date in the Caribbean. Next slide, please. Further public health investigations are ongoing in the countries where monkeypox has been identified, including extensive case finding and contact tracing, laboratory investigation, clinical management and isolation, which goes along with supportive care. Genomic sequencing, where available, has been undertaken to determine which variant of the monkeypox virus, which is called a clade, there is in this outbreak. Vaccination for monkeypox, where available, is being deployed to manage close contacts, such as health workers. WHO is convening experts and have already convened experts to discuss recommendations on vaccination. Next slide, please. In terms of surveillance, for a suspected case, we're looking at a person of any age presenting in a monkeypox non-endemic country, and the endemic countries are in Central and West Africa. So any person presenting with monkeypox in a non-endemic country with an unexplained acute rash and one or more of the following signs or symptoms since the 15th of March this year. For example, headache, acute onset of fever more than 38.5 degrees, swollen lymph nodes, muscle and body aches, back pain, profound weakness are some of the things. The rest of it there has to do with, for example, a common cause of a rash that you can't explain. Next slide, please. In terms of the WHO risk assessment as of the 21st of May, endemic monkeypox is normally geographically limited to West and Central Africa. The identification and confirmed and suspected cases of monkeypox without any travel history to an endemic area in multiple countries is atypical. That's why there's an urgent need to raise awareness about monkeypox and undertake comprehensive case finding and isolation, which, as I mentioned before, must have supportive care, contact tracing, and supportive care to limit further onward transmission. We are also looking, as part of risk assessment, cross-protective immunity from smallpox vaccination. So those of us who've been vaccinated with smallpox, there is protection. But this will be limited to older persons, since populations worldwide under the age of 40 to 50 years no longer benefit from protection from prior smallpox vaccination programs. There's little immunity to monkeypox among younger people living in the non-endemic countries since the virus has not been presented there previously. So historically, vaccination against smallpox had been shown to be protective against monkeypox. There is one vaccine, BN, and there's no one specific treatment that was approved for monkeypox in 2019 and 2022 respectively, but these countermeasures are not yet widely available. Sorry, there is one specific treatment, which is named there tecovirimat. In terms of advice, on the next slide, WHO advice. Countries should be on the alert for signals related to patients presenting with atypical rash that progresses in sequential stages, some of which I mentioned before, but you can see there, vesicles, pustules, scabs, etc., at the same stage of development over all affected areas of the body, and that may be associated with fever, enlarged lymph nodes, back pain, and muscle aches, some of the symptoms already mentioned. So these individuals may present to various community and healthcare clinics, including but not limited to primary care, fever clinics, sexual health clinics, and infectious disease units, obstetrics and gynecology, urology, emergency departments, and dermatology clinics. So increasing awareness among potentially affected communities as well as healthcare providers and lab workers is really essential for identifying and preventing further secondary cases, and also, of course, to manage the outbreak. Next slide, which is my last slide on WHO advice. So for considerations, we need to look at the following: surveillance and reporting, case investigation, contact tracing, risk communication and community engagement, large gatherings, clinical management, and infection prevention and control in healthcare settings. And you would see this is very much in keeping with the same protocol for communicable diseases. So for more information, there's a website there for WHO that you can visit, but WHO will be continuing to provide interim technical guidance in the oncoming days and continue with the convening of experts to provide recommendations for vaccines. Thank you very much, Mr. Alexander.
Thank you very much, Dr. Wheeler. I now hand you over to the Honorable Minister, who will update us on the vaccination figures and other pressing issues concerning the national COVID-19 response. Minister.
Thank you very much, Al. Good morning to Dr. Parashram, and welcome back, Dr. Wheeler. Thank you for your expertise this morning and guidance. Good morning to ladies and gentlemen of the media and everyone who has tuned in and listening with intent this morning. So briefly, the vaccination numbers. First dose, 691,484, 49.4% of the population. Complete vaccination schedule, 712,349. That's 50.9%. So we have gone over the 50.8 where we were stuck for a long time. Number of people boosted, 156,290. As we are on the vaccination front, let me just advise the general public that the pediatric vaccines we got in on Monday from the Kingdom of Spain, and let me thank the people, government and people of the Kingdom of Spain for their generous donations of 43,200 doses of the pediatric vaccines. I think we are one of the first, or if not the first country in this region to receive that. Other countries will receive, and we really thank the people of Spain. The rollout started today. I just want to alert the population that just like the adult Pfizer vaccines we got in last year, the labeled expiry dates of this vaccine is April of this year, April 2022. But just like the adult doses that we got in last year, Pfizer has extended the expiry position until October 2022. So we will be vaccinating those children who come into all our over 30 sites from today to be vaccinated. And we will continue, and we have more than ample time to give you your first shot. And then your second shot, which is due 21 days after, CMO? 4 to 8 weeks after you do your second shot. So that's where we are with the vaccination front. Ladies and gentlemen, as we monitor international developments, regional developments, and look at our local position at this stage of the COVID pandemic, where we see a plateauing of the hospital numbers at around 200, give or take, and we are seeing a waning of this acute phase of the pandemic. Please note, the pandemic is still with us. What we are seeing in Trinidad and Tobago is a waning of the acute phase of the pandemic. With that in mind, the Honorable Prime Minister has authorized me to make the following announcement as far as some relaxation of measures are concerned. So, as of Wednesday, June 1st, 2022, I am authorized by the Honorable Prime Minister to tell the country, especially those who travel, that the TT Travel Pass system will be discontinued as of next Wednesday, 2022. What this means is that unvaxxed nationals and non-nationals can enter Trinidad and Tobago, so you don't have to prove your vaccination status. However, you do have to provide either a negative PCR or antigen test 48 hours prior to entry. So let me repeat that. From Wednesday, June 1st, which is next week Wednesday, we will be discontinuing the TT Travel Pass system, which will allow unvaxxed nationals and non-nationals to enter Trinidad and Tobago, but they must provide either a negative PCR or antigen test 48 hours prior to entry. So the question needs to be asked, what if I don't have a negative test? In the absence of a test, that person will be asked to go in to state supervised quarantine at their cost and provide a negative PCR or antigen test at any time during their quarantine period as a condition of release before going home. So if you don't have that test, you will be quarantined, but you can provide a negative PCR or antigen test whilst in quarantine, and once it's negative, you will be going home. So that is a major adjustment. All other measures stay in place. Example, masking. We continue to ask people to adhere to the public health guidelines, especially about masking. Do your own risk assessment as to what level of risk you want to undertake for yourself and your family and your children, especially if you're unvaccinated, to go into large crowds where people may not have on their mask and so on, because at this stage of the pandemic, a lot of the responsibility for the management of this is shared between the Ministry of Health, the government, and more importantly, the people of Trinidad and Tobago. So, Al, that's where we are, and I think we can take some questions and answers.
Thank you very much, Minister. And as we move into our question and answer segment for this conference, we want to remind our media representatives to indicate their name and the name of the media house that they represent before posing their two brief questions. Kindly indicate which presenter each of your questions will be posed, and if time permits, we will field an additional question from each media representative. We'll start our question and answer segment with GML, Guardian Media Limited.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Okay, Minister, both my questions are to you. last week, Friday, you would have convened an emergency meeting with Ministry of Health officials as well as Dr. Erica Wheeler, I believe. But what I want to know is what were the outcomes of that meeting? Is anything going to be done differently locally? Are we putting anything in place? And secondly, is it possible that you have the figures for the amount of people that would have accessed the second booster dose since we started that on Friday? Yeah.
Yeah, thank you, Rashad. So, yes, the meeting that we convened on Friday was a meeting. It wasn't necessarily an emergency meeting. It was a meeting. And on that meeting, we decided on the following. One, that we need to engage the public, because one of the best lines of defense in a public health, in an emerging public health issue, is a public that is informed, educated, and updated. So we issued a press release Friday after lunch, I believe it was, where we alerted the public that this meeting took place, who was present. We alerted the public of the main signs and symptoms. We asked the public to be wary of contacts with persons from any country that has confirmed cases of monkeypox. And to that, in the release, we issued a hyperlink to PAHO's website, which goes directly to the page which deals with the countries that have reported cases. And that list is updated on an hourly, if not daily basis. Coming out of that also, we ask persons to be wary of contact, especially close physical contact with anyone from any of these countries reporting positive cases. That's what we did. Secondly, we re-energized, re-emphasized the screening protocols at our ports of entry because one of the symptoms of monkeypox, I believe, is fever. So we re-energized that. On that same day, the Chief Medical Officer will have written to all RHAs for them to spread the word to all their physicians and clinics, especially dermatology clinics, A&Es, signs and symptoms of monkeypox, how to treat, isolate, because that is going to be important as a mitigation strategy. Isolation is important. How to identify a case, what is the case definition, and you would have heard Dr. Wheeler, I believe, speak about that this morning, I believe. Yeah, the case definition. So all that information was sent out to all the RHAs. I also alerted the president of the TTMA, Dr. Marissa Nimrod, about the situation. So the private sector could also be similarly informed and educated. And those are the steps we are taking. In addition to those steps, Rashad, and I really want to thank you for that question because it allows me to tell the population what we are doing. You would have heard that there's a possible vaccine for it called JYNNEOS, all capitals. We are in the marketplace for that vaccine. However, the vaccination strategy as it stands now for monkeypox is not a general population-wide strategy like COVID. Basically, if you have a suspect or confirmed case of monkeypox, you vaccinate the immediate circle, the immediate contacts of that person. So if I come down with it, and I am close to Al here this morning, the CMO, Dr. Wheeler, my family at home, that is what you do. So you will identify close contacts. That's why Dr. Wheeler said contact tracing is important. So we are in the marketplace. We sent out feelers last week for vaccines. And 2, for symptomatic treatment, there's an antiviral drug called tecovirimat. We are in the marketplace for tecovirimat. And that's a lot that we have been doing since last week to today, all right, to keep the population abreast of the situation and to get possible vaccines and possible antiviral agents. On the second booster, Rashad, Total second booster as of May 19th, 2022, 1,967, I believe it is. But I will confirm that figure for you. Right? Thank you very much, Richard, for your two wonderful questions.
Thank you, Minister. We go to azpnews.com. We are ready for your questions. Good morning.
Good morning to the panel. Chantal Fletcher of AZP News. My first question would be to the Minister of Health.
Go ahead, please, Chantal.
Sorry. Minister, upon securing the vaccines for the monkeypox virus, would there be any considerations to implement a mandatory quarantine period, like Belgium, for persons who may be tested positive for the virus? And a second question do you expect that all of the pediatric Pfizer vaccines to be used up, and whether we are looking to procure any more for usage? Thank you.
Sure. In terms of the quarantine period, the incubation period for this particular virus is a little bit different. It's 5 to 21 days, as opposed to what we would have used for COVID-19, 14 days throughout. So if there is to be a quarantine period, it'll probably be 21 days to ensure that there's no further spread. I think it's a little bit early to say whether that will be, what form or fashion the quarantine will actually take place. If we're looking at primary contacts, secondary contacts, it's a different virus, spreads differently from COVID-19, generally it spreads by close contact with affected persons. It can spread by respiratory droplet as well. But we have to bear all the things that we have in place. We do have mandatory public masking still in place, and we have other guidelines that will help us as a population. So we'll be certainly looking at quarantine as a measure that could be used in terms of decreasing the risk of spread if we do detect cases, depending on the scope of it and the scale of it.
Thank you. And I will answer your question on the pediatric vaccines. So we have 43,200. That could vaccinate over 20,000 children. We have only started the program today. It is way too early to determine whether we need more vaccines or not. But the possibility of more is always there, but it is way too early to make that determination. I just remembered two other measures, Richard, to come back to Richard's question about monkeypox. I just remembered two other things that we are doing for monkeypox is working with CARPHA, one, to establish their testing protocols for the CARICOM region. And two, we are working with the University of the West Indies to give them the capability to do genomic sequencing of the monkeypox virus. So those are two other measures that we put in place since last week, Friday, working with CARPHA for a CARICOM response to testing, and UWI for a CARICOM response to genomic sequencing. So a lot of work has been done between Friday and today on monkeypox. Thank you very much.
Thank you very much, Minister. We go to Newsday for your two questions.
Hi, good morning. My name is Rhea Chetram. My questions are the second booster shots that are already in circulation were for a particular age group, particular categories. When would the other categories be opened up? And two, how many mass vaccination sites are there, and are the vaccines available at all the health?
Okay, so I think I got most of your questions because you were breaking up a bit there. The vaccination sites for the second booster are your typical mass vac sites that everyone is accustomed for. The vaccination sites for the pediatric vaccines, which started today, it is published in two of the daily newspapers. The sites are there. It's over 30 sites, a combination of the mass vac sites and selected health centers to make accessibility as easy as possible, especially for the rural communities and villages and so on. So that is where we are at the time. As your other question about expanding the categories of persons, at this time we are following WHO's guidelines, which say that anybody over 60 regardless of your health status, should access the vaccine because they are at most risk. 2, all healthcare workers, regardless of age, because they are the most exposed. And then the immunocompromised, regardless of age, because they are most at risk again. So those are the 3 categories we are looking at this time based on WHO's recommendations. Okay? Thank you very much.
Thank you, Minister. With that, we go to TV6. TV6, we're ready for your questions.
Hi, Vanessa Cutting, TV6 News. Where it concerns the persons who we are still seeing passing from COVID-19, have we been doing sequencing of these particular patients to determine whether persons are actually dying from Omicron or if it's still the Delta strain that is causing these persons to be admitted to ICU and passing away? Also, I was going to ask whether we have the infrastructure in place to test for monkeypox, but seeing as you mentioned that things are already in a gear, could you possibly give us a timeline? And in relation to that, I wanted to find out if there's any consideration at this time for mandating that persons coming into the country present negative monkeypox tests. Thank you.
All right, so in terms of your first question related to sequencing, our normal criteria pertains, and I'll just give you an idea. When we would have done some testing a couple of weeks ago, out of 118 samples that we took from various sites, 117 actually was the Omicron variant. So there was 1 Delta in the mix of it, meaning that there is still a presence of Delta, but the majority of cases that present to hospital and even the deaths have been associated with Omicron in most instances. As it relates to testing of monkeypox, I would have continued the conversation with the Caribbean Public Health Agency up to yesterday, and they have indicated that they're in the process of establishing the capacity to test in Trinidad. But in the meantime, what we do, and for any neglected tropical disease, we have a process in place where the samples go through the Trinidad Public Health Lab to CARFA, and that sample is then packaged and goes to CDC. Their turnaround time they gave us is anywhere between 7 and 10 days to have that result back to us. So there is a mechanism in place already through the Caribbean Public Health Agency, but they're trying to get in-house in Trinidad and Tobago testing for Trinidad and the CARICOM states in the near future, and they will alert us when that is in place.
Thank you very much, CMO. We go to Guardian Media Limited for a follow-up question.
All right, thank you, Al. Minister, by chance, do we have an update on the school numbers of cases, COVID-19 that is?
Yeah, so I just got them in 2 seconds ago, Richard. What I have are the global numbers, so I'll give you the global numbers as it applies to all 7 districts in Trinidad for the period 16 to 22nd May. So for the period 16 to 22nd May, Richard, just bear with me while I go into my phone, please. It's 233 cases, so there has been a drop. Number of schools testing for positive cases, 104. So there has been a drop to the number of schools. And the number of schools tested, 116. So those are the global figures which I have easily at hand. So there has been a decline from my last report last week. Right? Thank you very much.
Thank you, Richard, for that question. And with that, we go to Newsday for another follow-up question. Newsday, good morning.
Hi, good morning. Are you all considering any type of travel restrictions as it relates to monkeypox from people entering the country from Africa?
No, so at this time, as I just announced, we have actually freed up the ability of people to fly in and out of Trinidad and Tobago. So at this time, there is no intent on the part of the Ministry of Health to recommend any travel restriction due to monkeypox from any country on any part of the world. Thank you.
Thanks for that, Minister. We go back to Guardian Media Limited for another follow-up question.
All right, Al. Minister and CMO, now, I assume with this whole monkeypox thing and on that meeting that you all would have had on Friday, there would have been some sort of risk analysis for the likelihood of that disease reaching here in Trinidad and Tobago. Would you be able to say what are the probabilities of that?
Okay, so Richard, we can't put a number to say there's a 10% risk or 40% risk. We can't put a number on that. That will be foolhardy. However, as I said, I have recited all the measures we are putting in place to mitigate spread of monkeypox. I don't know if the CMO wants to come in again.
So generally, it is a communicable disease. We are part of the global community. Once you have movement of people from one part of the world to the next, you tend to have movement of disease as well. So, I mean, the rating for the region of the Americas that have been put through the IHR mechanism is probably moderate risk at this point in time, and that will change as time goes on. There are cases in America, there's cases in Canada, there are cases in UK and Europe. I mean, we have frequent travel to those areas. So, moderate risk at this point is probably the best assessment so far.
Thank you very much, CMO and Minister. So we go back to TV6 for a follow-up question.
Hi again. Is there currently any data, any cases of persons having contracted probably both monkeypox and COVID at this time? Are there any discussions surrounding this and the level of, risk that this could present with these two viruses in circulation?
Yeah.
Thank you for the question. The data that we have on monkeypox is what I shared with you earlier with the 19 countries and the number of confirmed and suspected cases. So as of yesterday afternoon around 3, I mentioned there were 158 confirmed cases and 117 suspected cases. And these are across 19 countries: Argentina, Canada, the US, Pakistan, Sudan, Austria, Belgium, Denmark, France, Germany, Israel, Italy, the Netherlands, Portugal, Spain, Sweden, Switzerland, the United Kingdom, and Australia. So those cases that I mentioned are scattered across those 19 countries, and the confirmed cases are 158 and 117 suspected. So we will continue to update the ministry as we get further information on the number of confirmed and suspected cases. I also mentioned to date there were none in the Caribbean, and there are no deaths so far globally from monkeypox.
Certainly good news, Dr. Wheeler. We go back to Guardian Media Limited for a follow-up question.
Hi, this question is for Dr. Wheeler. Now, I just want to pick up on where my colleague would have left off a few questions back about expanding the categories for that second booster. And I know, Minister, last week we've had your statements and sentiments on where we are at on that, and that we won't be doing it because of WHO's guidance. However, Dr. Wheeler, isn't it the case that the WHO's guidance on how to administer these vaccines take into consideration a limited supply chain of these vaccines, which is why the most vulnerable are given preference? And why I'm asking that is, again, Minister, seeing that we don't really have a supply issue in Trinidad right now, given that we're practically begging people to take the vaccines, what about opening it up to those who may be wanting the vaccines, since we're not going to be getting any more?
So, yeah, so Rashad, the answer to that question from last week to this week remains the same. The decision to administer the second booster to the groups I have described is based on WHO's recommendations, which we are sticking with. And as I indicated, to do otherwise will not be scientific. We are not going to administer vaccines because they are going to expire. What happens in the case of a lawsuit? Right? So we have always been guided by the science, and we continue to be guided by the science and the advice from the WHO that the second dose be administered to those over 60, regardless of their health status, because they are a high-risk category Second group, any healthcare worker, regardless of age, because they are a high exposure group, and then the immunocompromised, for obvious reasons, because they are also at high risk, regardless of age. At this time, until WHO's advice changes, we will not be vaccinating anybody because we have a surplus of vaccines. To do so will not be wise, it may be deemed reckless, and could lead to all sorts of legal troubles for the taxpayer of Trinidad and Tobago. Thank you very much.
And thank you, Minister. So our final question comes from TV6. We're ready for your follow-up question.
What is the long-term outlook for persons infected with monkeypox, particularly those in the vulnerable demographics with underlying sicknesses and these types of things?
Dr. Wheeler?
Thank you for the question. You asked about the long term. There are not, this is not a serious disease that regularly leads to death. I mean, the incubation period is between 5 and it's 21 days. But this is not like a deadly disease we're talking about. So the most important thing is the contact tracing in order to ensure that there isn't any further spread. But usually it's in small clusters. As we said, it's in the concern is because it's in the non-endemic countries, meaning outside of Central and West Africa. But in terms of the long-term outlook on it, it is not, I mean, I'm assuming you're concerned about risk of death and so on. But remember, there's also an isolation period until persons no longer show symptoms from the lesions and so on their bodies. And as the minister already said, the country is looking into procuring either vaccines or antivirals. So I think that we need not be too concerned at this point in time. There are no serious long-term repercussions, or there's no serious long-term problem with monkeypox. It's just that we know it is unexpected and unusual for persons to be coming down with monkeypox outside of the areas where it actually is endemic, and that's why the country has chosen to be on the alert. Thank you.
Vanessa, you are asking a very important question, and if I may direct members of the media and the general public to a CARFA publication, their update May 23rd, 2022, which is just 2 days ago. This is what's put out by CARFA. I have a hard copy of it here. It's an excellent summary of everything we know about this current outbreak to date. It's titled Monkeypox Outbreak in Non-Endemic Countries. CARFA urges Caribbean countries to raise awareness and be vigilant. And on page 4 of that, under the subheading, Incubation Period and Clinical Details, it is said, they are saying, monkeypox symptoms often last from 2 to 4 weeks and are mild in most persons, but severe illness and complications such as sepsis, secondary infections, and encephalitis may occur. So I think that more or less gives you a very good picture of what Dr. Wheeler is saying. In most cases, it is mild, 2 to 4 weeks, but like any other viral illness, there can be these complications in some persons. Okay? So I will recommend everyone get a hold of this CARFA update, May 23rd, 2022. It's on their website. It will answer and educate. It will answer a lot of questions and really, really educate us. It is an excellent, excellent publication. Thank you.
Thank you very much, Dr. Wheeler. And Minister, I see that GML has their hand up. Richard, we'll take your question.
Oh, promise this one will be my last question for the day, right? On the topic of monkeypox, I just want to kind of broaden the discussion a little bit.
Sure.
What what I want to know is, do we do surveillance within our animal populations within Trinidad and Tobago, and how much emphasis is placed on that? And I'm speaking with the context of we have a lot of illegal animal trade going on, coming over from Southern America and stuff. And are we monitoring to make sure that we don't see our own set of own kind of outbreak?
Yeah, so it's a joint monitoring that is done between the Ministry of Health and the Ministry of Agriculture. The Vet Public Health Unit of the Ministry of Health will lead from our side, and there's constant monitoring, especially, for example, in the howler monkey population in certain parts of the country. What we have noticed is trends when you look at, for example, yellow fever. When they start to die or get ill, they actually leave the forested regions and come to the verges of the roads and those kinds of communities. So there has been monitoring throughout, and sampling does occur in terms of blood sampling and pathologic sampling in the case of deaths through the Vet Public Health Lab in UE, and so that program remains in place, and that's how we monitor our animal population from time to time, just making a note that monkeypox can not only primates infect, but small mammals, rodents, and other types of like squirrels, for example. This virus can actually infect those, and it is primarily a zoonotic disease, meaning that it can jump from animals to humans. So that is something that needs monitoring, and the Vet Public Health Unit of the Ministry of Health has been doing so as well.
Thank you very much, CMO, and the rest of our presenters, and of course you, the media. We have come to the end of today's media conference. Thank you very much for tuning in this morning. And please remember that the COVID-19 vaccine remains an essential tool in the global fight against COVID-19 vaccines. And we also remind you that the Ministry of Health has all the COVID-19 vaccines are WHO approved, safe, effective, and free. Let's all do our part. Let's vaccinate Trinidad and Tobago. Goodbye for now.
Running smoothly since the beginning, and we can expect that will continue to run smoothly, and we will achieve our target.
So our goal